Hi, I'm George Valiotis. I'm the Executive Director of the European Health Management Association, and I'm going to present to you today about the BeWell project. Now, the BeWell project ultimately has a strategy that contributes to lifelong learning for European health and care professionals. And I can tell you all the details about the strategy and what it aims to do. But what I thought would be more useful today is to explain to you what's the process we've used, who we brought together, how we did it, and therefore, how does that make it more likely that whatever strategy we do, whatever objectives we ask for, are going to be successful. And let me show you how we've done that. I'll start by explaining to you what are the objectives of BeWell. So it's a cross-border, a cross-collaborative endeavour. We want a lot of different people involved, and I'm going to explain them to you in a moment. BeWell is going to act as a roadmap to advocate for lifelong learning and continuous professional development. It's therefore going to raise awareness about the advantages of the uptake of digital and green upskilling and reskilling. So digital and green are the two key themes, and upskilling and reskilling of the European healthcare workforce is the other key deliverable for us, key benefit for us. We want this strategy to call upon policymakers to integrate the health and care workforce needs into the design and implementation of policies. And we hope that by doing it in the way that we are, will make it much more likely for better policy development to happen. So let me tell you a bit about the partnership to start with. We've brought together 25 partners. 24 are full partners, which means they're part of the deliverables and have to contribute particular pieces of work. And then 5 of them are associate partners, which is just people who are very strong supporters of this project and really strongly aligned to it. Now, on this slide, I show you some of the diversity, but let's dive in a bit deeper. So firstly, we need 4 different types of stakeholders. We needed education providers because we're actually building education, we're piloting education courses. We needed research organisations to make sure we have the right evidence. We needed labour market actors to represent the healthcare professionals. We need this strategy to be really by them and for them, and then channel their voices towards decision makers. And we needed NGOs as facilitators of a lot of that process. So let me dive in even further to explain to you how we went about doing that. We knew that we needed a geographic diversity because the huge diversity of Europe means that we want to benefit from all that different creative thinking. We've gone as far down from the southeast of my home country of Greece, up through Bulgaria, Romania, through Central Europe, lots of different countries being involved there, and as far north as Norway, and as far west as Ireland. So very good geographic diversity. And then looking now at the different organisations. So the associate partners, those that are really good allies of the project, include EPSU, who I really thank for inviting me to present today. CPME, which is primary care doctors. KU Leuven's a university in Belgium who do health management. Hosbeam is another one of the unions who've been fantastic. And Erasmus MC is the medical centre in the Netherlands. In Rotterdam, who give us real good insights into the realities of how these issues impact exactly into healthcare centres. So those are associate partners. As for our full partners, let's start with the labour market actors, where we've got the people doing representing the voice of healthcare professionals, and really large groups. So the European Federation of Nurses, the European Specialist Nurses Organisation, the European Forum for Primary Care, and the Pharmacy Guild as well. So we're hearing from the different professions. And we also have CESI, who are another union, which makes sure that we are really led by the voice of healthcare professionals. We have several higher education and vocational education and training providers as well, and they come from different places all across Europe. We have several different NGOs. You can see in the middle there, Emma, my organisation. And then I'll just point out a couple of others. I wish I could describe all of them, but we have Eurega as one example in the bottom left. So they're the network of regional authorities, and they make sure that we speak to the regions, really down into the detail of the people who are actually delivering healthcare. And we have COSIA is another example I'll give you. They represent industry. So when we talk about green and digital, what exactly are we talking about? What are these green and digital innovations? And so that's why we have industry who are the ones developing some of these innovations. So a real diversity from across lots of different players. And then finally, we have BeWell, who is a research organization in the Netherlands, and the European Observatory on Health Systems and Policies, who I think many of you will know, both of which I'm sure most of you will know. But they're making sure that we have the evidence base to make sure the foundations of our strategy are well set and well understood. And then whatever we build on top of that has a much better chance of succeeding because we've learned from the evidence that's out there. So you can see we've covered a lot of different bases. And now what do we do with all of that? Well, collectively, we've come together and we've published the first draft of the strategy. You can find the strategy online right now. You can Google BeWell project and you'll find our website and you can download the strategy there. In the strategy is in the first draft, and we've deliberately published a first draft so that we can have opportunity to really consult broadly on an actual published piece, and that'll make it more likely that we can have all the different voices of people heard, and they'll have something tangible to speak to. So those 6 objectives that are in the strategy, no doubt they'll be familiar to you. But what's special about them in our setting is that they've been developed by all of those partners that I've just described. We have really broad buy-in from all of the people that have a role in how we support our healthcare professionals. And the one I'll take your eye to is objective number 5, where we recognise we must be sure to be looking after the physical and mental health and well-being of our healthcare workforce. We know that they're under tremendous stress. So before we even start to think about further education and training opportunities, let's make sure that they're safe and okay first. Create as best as we can an environment that is conducive for good learning and development. And then we can tackle things like green and digital skills, on creating a culture of lifelong learning, and making sure that the people who provide the education have the skills and knowledge and the tools that they need so that we can provide them with the best possible future learning. So that's where we started with the strategy. And next, we wanted to make sure that our strategy can target decision makers and services at local level, national level, and a European level. So again, you'll remember now all of that diversity I've shown you helps us target those different groups more effectively. Now, the other thing that's really important about the uptake is the Pact for Skills. Now, you'll hear from my colleague about the Pact for Skills in much better detail than I can provide. But the way that I think about it is the Pact for Skills is the building. And the building has not just health, but also, let's say, car manufacturing and fisheries and all the other things in there. So that's the whole building where they create a building to say, everyone come together and make a pact, make a promise that you will support a culture of lifelong learning and that you'll address all the inequalities and the diversity so everyone can benefit. So that's great. That's the space. I mean, I say it's a building, it's just a metaphor, but that's the space. The Pact for Skills is the space. In the Pact for Skills, we take a big room, and our room is the large-scale partnership where we want everybody to get involved in a community of practice that dedicates itself to these themes of lifelong learning and of upskilling and reskilling on green and digital skills. To do that, think of it in these 3 ways. So the first part is the BeWell partnership. That's just 29 partners. So they'll do great work, and they've all done great work, and I thank them for that. But we need more. So that's the Pact for Skills and the large-scale partnership on health. That's where the full diversity of care providers can come together and healthcare professionals to have their voice heard. And then finally, we'll also have the public consultation, which gives a chance for anybody else who hasn't yet had a chance to speak into the strategy. By doing that, we will be able to commit to all the right objectives that suit everybody, involve the diversity of people, secure the financing to actually take these initiatives forward, and then implement it successfully at any level that is needed. I thank you for your time today. My name is George Valiotis. I've given you my colleague's email, Ludmil Ninov, because he's the program manager of BeWell, but we work so close together that if you get in touch with him, it's the same as getting in touch with me, and we welcome hearing from you if you'd like any more information. I otherwise thank you for having me today, and I wish you all the best with your initiatives in your country, and I really do welcome any further discussions in any way. So take good care, and I wish you good luck.